I'm Dr. Ryan Stanton, and the doc is in. As the COVID-19 or coronavirus situation continues to evolve, we wanted to bring you more information from here at Everyday Med. The World Health Organization has put together over 55,000 patients to characterize the most common symptoms associated with COVID-19. We're now seeing at least one case in the majority of U.S. states. The best protection is still right behind me. That's the sink. Soap and water, washing your hands for 20 seconds, thoroughly scrubbing all surfaces of the hands and thoroughly drying those hands. If you don't have access to a sink or in between times, a hand sanitizer is beneficial, though not quite as effective. Fever over 100.4 is going to be present in about 9 in 10 patients. About 2/3 of patients will experience a dry or non-productive cough. The remainder of the symptoms are present in less than 40% of patients. This includes fatigue, productive cough, or shortness of breath. Other symptoms are much more rare in this condition. We're now seeing at least one case in the majority of the U.S. states. This means we need to be more aware with the spread, as it's not typically in states associated with international travel. The recommendation now, if you start to develop symptoms that may suggest COVID-19, calling the emergency department or your primary care physician to get guidance on next step. You may not be directed immediately to a healthcare facility, secondary to help protect you and others from potential spread if it is eventually confirmed. We want to make sure that our services are not inundated or overflowed with people seeking care, but also want to be available to treat those who are in critical condition. If you're elderly, have increased risks of comorbid conditions such as lung diseases, you may want to consider some of those travel plans in terms of going to high-risk areas or areas where there will be large groups of people. Otherwise, this is not a time to panic. This is a time to gather information, to make sure that we're doing everything we can to prevent this infection and others, and continuing to monitor sources such as the CDC and World Health Organization as we move forward. You can join the conversation on our Doc is In Facebook page and at Everyday Med on Twitter. I'm Dr. Ryan Stanton, and the doc is out.